Hi, this is a short video to explain very simple breathing techniques to improve your immune system and improve your overall health. Most adults are breathing very shallow, mostly through the chest, and so an average of 15 to 18 breaths per minute is very shallow. But actually the first years of all of our life, those intercostal muscles are not developed, so we're all breathing through our belly. And so it's way better to breathe through the belly. It's also called diaphragmatic breathing or belly breathing. So to show you the difference it makes, breathing through here, it only oxygenates and reaches the upper part here of the lungs. And by breathing through the belly, it's a much deeper inhale and it reaches way more of the tree-like branches of the lung wings. So imagine the lung wings have a tree or a plant-like structure inside of us. So they have like this root-like branches there going down from the throat here. So if we're only breathing here, we cannot bring so much oxygen to all those tree-like branches. So it's a way more holistic and way more deeper breathing, and has also been tested to prevent high altitude sickness, and has been studied to, even in combination with other exhales and breath retention, to reduce inflammation. And regarding COVID-19, there's a lot of comparison to high altitude sickness. There's an inflammation going on in the body, especially here. It's a acute respiratory syndrome, of course. So it really attacks the breathing patterns. So it's not been tested, breathing techniques to help with severe symptoms. There's some anecdotal reports, but I recommend this just to even with mild symptoms or to improve your well-being at home. And so very simple, just lying down, I recommend. Just lie down, find a comfortable spot, maybe placing one hand on the lower belly, placing one hand on the chest, and then sensing how you're breathing. If you're breathing mostly through here, maybe exploring how can you expand your belly first. So fun thing, making this a six-pack free zone. So even if you focus on fitness, like making sure that you're really relaxed here and allowing yourself to have the biggest belly possible, and really exploring how can you tap into the diaphragmatic breathing muscles, which are here. So they're kind of in between the chest and the belly. So making sure that you tap into that, and they're probably not so trained if you're not used to deeper breathing. So sensing how can you train those breathing muscles here to expand your belly. So, and then I recommend just a letting go exhale. Really making it also an exercise to lift up your lower hand as much as possible. So like a little mountain, like a balloon, and then lift up your chest, and then just a letting go exhale. You might feel a bit lightheaded or dizzy. That's why it's nice to lie down to make sure that you feel comfortable. And the lightheadedness and the dizziness is part of a change of blood chemistry. So I recommend to keep the focus on the breathing, even if you feel that lightheadedness and dizziness. It's just part of improving and changing your blood oxygenation and your blood chemistry. Just lying down, maybe exploring with every inhale, how can you train your diaphragmatic breathing muscle? So a very simple trick is to slow down your breathing, to slowly expand your belly, and then expanding your chest. So as you might see, it's a little bit like a wave, first expanding the lower belly, then the upper belly, and then the chest, then the upper chest. And it's much easier to do this while relaxing any muscles on the outside of the body and just to using the diaphragmatic breathing muscles inside. And really every inhale could be a beginner's mind, to explore how to expand from within and how to expand the belly, the chest, the throat, almost like a balloon filling up. And so it's very similar to if you think of wind or atmospheric pressure changes. That's what's happening. We're creating space in our body, and then there's a pressure difference inside our lungs, so air flows in. So we're not really inhaling air, all we're doing is creating space inside of us, and then air flows in naturally. Every inhale, trying to sense how can you connect with your breathing muscle, become aware of it, and to train it, to expand your belly as much as possible, and then your chest, almost as you would breathe into your shoulders and your throat, and then just a letting go exhale. You can keep doing this and really exploring how can you slow down your breathing as much that you maybe aim for a 1 minute long inhale, really slowing down your breathing patterns, and thereby training your breathing muscle. If you train your breathing muscles, it becomes more trained and it becomes more of a second nature. So you can breathe deeper over time. Humans breathe over 23,000 times a day, but oftentimes very shallow. So training your breathing muscle can feel like an exercise. So also you might feel that it's a little bit painful or so here. It's just because it's a novel training for the ones who are new to breathing exercises. So sensing, gently expanding your belly. And it's totally fine if you can first only expand your upper belly. So it's like learning how to expand our belly and then expand our chest. So when we're expanding our belly, we're using the diaphragmatic breathing muscle. And if we're expanding our chest, we're mostly using our intercostal muscles. So there's a difference. That's why, like, at the start of the inhale, it's like a wave, first expanding the lower belly, then the upper belly, and then the chest. And there are different muscle groups involved in that. So tapping into those different muscle groups is important and takes some awareness, but usually it gets you, lightheadedness, a little bit dizzy, but it's really a good sign, or yawning. All of those are signs that you're changing your blood oxygenation and your blood chemistry. I also recommend to add a smile. So while you're inhaling, if you feel a bit lightheaded or dizzy, just adding a smile, and that will also counterbalance like any kind of like dizziness or lightheadedness. And it's a trick from laughter yoga and positive psychology. Another exercise, if you want to have a little bit of a longer practice, is to do a little body scan, to lie down or lean back. If you're like at work, for instance, you can also just lean back in a chair, just tapping into different body parts, maybe tapping into your legs, your feet, your torso, your arms, and then just tensing every body part, including your facial muscles. And then just relaxing the tension or releasing tension. Every inhale tensing, and then just a letting go exhale, inhaling, and then if you do that in the beginning and then do the breathing exercise, you might feel even more relaxed, and then you can really only focus on expanding your belly, then expanding your chest. So you really don't need to use any other muscles except the diaphragmatic breathing muscles and maybe the smile muscles. Yeah, that's it. If you have any questions, please reach out to me. I'm very curious if that helps you feel better, and wish you to stay healthy and all of us to come to a healthier and happier place again. Thank you. Bye.